my introduction has finished. So, shall I brief about the speaker?
No,
Shall we start now or shall we wait till 7:05?
7:05 you can wait. So I will tell you how
Okay.
usually we take or we go by the process. So chair will be introduced by our Pratipta Sarkar, my friend, and then chair will take over that. The chair will introduce the speaker, then the whole process continue. That's how it is.
Yeah.
And one more thing is that actually I'm playing multiple roles today with so many devices in and around. I am actually in an online interview process started at 10 o'clock. Still it is continuing. So
Okay.
I may leave in between. Please don't feel bad, especially Abhisweta Banerjee, please don't feel bad. After this one, I will connect to you once the session is over. Okay. So please.
That's no problem. Thank you, sir.
And Gireesh, please tell everybody should mute their the microphones, speakers. They should mute the speakers. There's lots of problems usually.
Yeah, true, very true. Something happened. Let me check what happened. Yeah.
Day after tomorrow is the election, basically. Here, even in Nagaland and as well as in Manipur, Arunachal. So right now, I'm in Dimapur. After
Okay.
this, tomorrow I have train early morning, 3:30. So from Dimapur, I have to go to Guwahati. From Guwahati, there is direct flight to Imphal. So 18, I will reach there tomorrow. Then 19 is the election, Lok Sabha election there. And 23rd, again, I have to come back. 22nd, I'm going to take this thing, some exam at Manipur University for psychology, on the paper, clinical psychology and developmental psychology. After, as soon as it finishes, then I have to rush back to Dimapur again.
You have a busy few days upcoming, Professor.
Yeah.
But what happened is that right now I'm in the hotel. So all the vehicles, taxi, cars, all are occupied by the government because of the elections. So I came quite early, but my train timing is 3:30 morning. So I hold this night, present night at the hotel. So it's like that only.
Very good. And
Okay,
this might be
shall we start, Dr. Gireesh?
Tell me. Am I
Shall
audible?
we start?
Yeah, please.
Yes.
Start now. Yeah, please. Invite.
Okay. Welcome everybody to our MAP talk, which we have on every third Wednesday. And this week we have Professor Tian Kiran Singh, who is from Nagaland Central Institute University, and he's the head of the Department of Psychology over there. He has done plenty of work in various fields. He has written a number of papers and presented in international conferences and, of course, national conferences. So he's going to introduce our speaker for today. We have a very interesting topic and I'm sure we're going to have a very interesting time. Handing it over to Dr. Tian Singh.
Thank you, ma'am. First of all, I thank the President of MAP, Mental Health Actions for People. And I also thank to Professor Krishan Gireesh for giving me the opportunity to chair the session. Without taking much time, just want to give the introductions or some brief about the speaker. So the speaker, Abhisweta Bhattacharjee, is a research project officer at UCC Academy, a subsidiary of University College Cork, Ireland, specializing in managing EU-funded research project with a master's degree in applied psychology from Trinity College, Dublin, and bachelor degree in psychology from the University of Calcutta. Abhisweta brings a diverse background in educational psychology, positive psychology, autism spectrum disorder, policy making, and dementia research. She has lots of experience in the field of dementia, including autism spectrum disorder. Beyond the doubt, she has the professional role and is the founder of Membrane, an initiative aimed at fostering peer support of people with lived experience and their career to advocate for public and patients' involvement in mental health.
We might
Yes.
have lost Professor there.
Yes, yes. Dr. Gireesh, please tell him.
Professor, you're
Midbrain aims to bring the gap and ongoing research efforts that directly. Am I audible now? It's disconnected in between.
You're breaking in between.
Yes,
Professor.
yes, it was breaking between. Sorry for that. So Abhisweta has served as an applied behavioral analysis tutor at anything else? At ABA Academy, let me finish, please. Sorry for that. So in this capacity, she worked with autistic children, providing tailored support to enhance their social skills and facilitate successful transitions into mainstream education setting through the principle of applied behavior analysis. Sorry for the disturbance. With that, I pass on to Madam Abhisweta. Madam, the podium is yours now. Thank you so much.
Thank you very much, Professor. It's a pleasure to be here and to be invited to be giving a talk. I will now share my screen without further ado, and I hope it will be as much of a learning experience for me as I'm hoping it will be for you. So one moment. So hopefully my screen is visible there.
Yes, ma'am.
Brilliant. Right.
Hello.
So I'll start off with the session. We will be talking about behavioral interventions in autistic spectrum disorder today. And this is the agenda we will be following. We will start with an introduction to autistic spectrum disorder, which I'll be referring to as ASD or autism, henceforth in the presentation. Then we move on and try to define applied behavior analysis, then go on to the practical aspects with assessment and treatment planning, treatment implementation, monitoring process and outcomes, and finally finish with ethics, misconceptions, criticisms, and alternatives. So what is autistic spectrum disorder? It is basically a developmental disorder characterized by difficulties in social interaction and communication, as well as restricted and repetitive patterns of behavior, interests, or activities. Now, the picture on your right will give you some aspects of ASD. Well, in infancy, children with ASD may not babble. Older children may struggle with nonverbal communication like eye contact and gestures, and they often lack interest in peers, preferring to play alone. They also find it hard to understand emotions, initiate conversations, or engage in imaginative play. Um, they may repeat words or phrases that they have heard immediately or after some time that they've heard it, and they have some difficulty with social interaction. Important to note, while ASD is commonly associated with childhood, its impact extends well into adulthood. Now, its presentation can vary widely depending on individual factors such as cognitive abilities, coping strategies, and the level of support available to the individual. Again, important, it's called a spectrum for a reason. It manifests differently in each individual, ranging from mild to severe symptoms. Now, it's usually divided into 3 different parts. ASD level 1, it requires some support, and people within ASD level 1 have difficulty initiating social interactions, and they might also have difficulties in organization and planning, which can hamper independence. ASD level 2 requires substantial amount of support, and for them, social interactions are limited to really narrow special interests. They have frequent restrictive or repetitive behaviors. And the final end of the spectrum is ASD level 3, and people in this area require very substantial amount of support because they have severe deficits in verbal and nonverbal communication skills, and they might face great distress or difficulty in changing actions or focus or transitioning. Oh, apologies. So I'll just go back one bit. A quick note on the prevalence of ASD. Now, this data to note is from 2020. There were not many large-scale studies post 2020 for autistic spectrum disorder, but if you're aware of any, please do let me know. Usually 1 in 100 children might have ASD, and it is very likely to be a boy because it is 4 times more common in boys. I've referenced these statistics down below. And here in this table, you'll have the prevalence of autism spectrum disorder in 8-year-olds. And this was a research done by the National Institute of Mental Health. And I will not go into the real details, but it is important to note that this is an estimate, and it represents an average figure. The reported prevalence varies substantially across studies. Some well-controlled studies have actually reported figures that are much, much higher than what I'm showing here. The prevalence of autism in many low and middle income countries is also unknown, as is its prevalence throughout different socioeconomic factors. So there's actually a lot of research to be done within the prevalence of ASD. Now, while researchers have made significant progress in understanding the potential causes of autism, it remains a complex and multifaceted condition with really no single cause. We will see a few of the main suggested causes by research. The first one, obviously, is genetic factors. And these play a significant role in the development of autism. Many genes are thought to contribute to the risk of ASD, and variations in these genes can affect brain development and function. However, no specific gene has been identified as the sole cause of autism, and the genetic landscape is really complex and heterogeneous. Having a family history and older parents are definitely important factors. Environmental factors such as prenatal exposure to certain toxins, maternal infections during pregnancy, or complications during birth may also influence the risk of ASD. However, the specific environmental factors involved and their interactions with the genetic factors are still being investigated today. ASD is also associated with differences in brain structure and function, including abnormalities in the areas of the brain involved in social interaction, communication, and sensory processing, which are pretty much the areas that are most challenged within ASD. And there is also evidence that suggests that disruptions in early brain development, particularly during critical periods of neural circuit formation and connectivity, may contribute to the development of autism spectrum disorder. It is important to recognize that autism is likely the result of a complex interplay between all of these different factors. The specific combination of factors that contribute to the development of ASD may really vary from individual to individual. Overall, definitely ongoing research is needed to further elucidate the underlying mechanisms and risk factors associated with ASD. We will now move on to the main matter of discussion for the day, which is applied behavior analysis. But first, what exactly is behavior? Now, the APA Dictionary of Psychology defines behavior as an organism's activities in response to external or internal stimuli, including objectively observable activities, introspectively observable activities, and non-conscious processes. So this means that behavior basically serves three purposes. Biological needs: we eat when we're hungry and sleep when we're tired. Reflexes: we cover our ears when we suddenly hear a loud noise. Or the behavior might serve absolutely any other function. Now, a function could also be communication. Communication is also considered behavior within applied behavior analysis. The bottom line is all behavior occurs for a reason. When we observe a behavior happening time and again, then definitely that behavior is being supported or reinforced in some way. Now, what is applied behavior analysis? Cooper, Heron, and Heward in 2007 defined applied behavior analysis as the science in which the principles of the analysis of behavior are applied systematically to improve socially significant behavior, and experimentation is used to identify the variables responsible for behavior change. There are 5 phrases that I've underlined here that are the key components of ABA. The first one, obviously, it's science. It's guided by scientific inquiry. Number 2, principles of the analysis of behavior, which means not all means of changing behavior qualify as ABA. Only those derived from the basic principles of behavior qualify as ABA. Applied systematically, all procedures within ABA are described and implemented in a systematic manner. Improve socially significant behavior, meaning the improvement in important and really socially significant behavior. And finally, identify the variables. We might use the different kinds of experimentation procedures to analyze the factors responsible for improvement and for challenging behavior within autistic spectrum disorder. Now, what do we mean by improved socially significant behavior? So ABA basically provides a structure for looking at human behaviors by focusing on what causes behaviors and how to increase or decrease behaviors. It also provides a really basic and nice structure for teaching new skills. So we might want to increase behaviors like language, self-care skills, and academic skills, and decrease challenging behaviors like tantrums, biting, kicking, crying, which happens a lot in ABA schools. Now, the evidence base for ABA therapy, really, when we talk about evidence base, we talk of 3 things: research evidence, clinical expertise, and client values and context. So when we say something has a good evidence base, we know that research supports the practice. We know that real world implementation in clinics supports the practice, and that it is in line with client values and context. So an interplay of these 3 factors will basically decide what is the evidence base for ABA therapy. Now, ABA is considered an evidence-based best practice treatment by the American Psychological Association. But more interestingly, Cambridge Center for Behavioral Studies lists 45 independent and systematic reviews and meta-analyses of research on ABA interventions. Each of these reviews cites the obvious positive results of ABA and notes that such results have been replicated in many studies. So As you can realize, ABA therapy for autistic spectrum disorder is supported by a very large body of empirical research. There's a small reference down below, which hopefully you'll be able to open when the slides are circulated later on. The reference has some really well-put case studies on autism, and they might be really interesting for you to refer to. I'll go on to some facts stated by the evidence base for ABA in autism therapy. The first really is early intensive behavioral intervention, which is EIBI. And this is a form of ABA therapy delivered intensively and in early life. And research suggests that this can lead to significant improvements in the developmental outcomes for young children with ASD. It has been associated with gains in language development, social interaction, and cognitive functioning, with some studies reporting long-term benefits into adulthood. Longitudinal studies have also provided evidence for the long-term effectiveness of ABA therapy in improving outcomes for individuals with ASD. These studies have shown sustained gains in skills and functioning over time, as well as improvements in overall quality of life and independence. Research demonstrates that ABA interventions can lead to generalized improvements in behavior and functioning, with gains observed in naturalistic settings and really maintained over time. This is important. How else would therapy be scientific? It's data-driven decision-making. ABA enables the quantification of the therapy and its outcomes. Well, this quantification actually enables the analysis of the efficiency of the therapy, with scope to make changes or modifications to the therapy, leading to the desired results. And finally, ABA is highly individualized. It's definitely not a one-size-fits-all, with treatment plans tailored to the unique needs, strengths, preferences, and goals of each individual. Now, research supports the effectiveness of individualized ABA in addressing specific areas of difficulty and promoting overall development and well-being. Now, ABA therapy is guided by the principles of behaviorism, which basically emphasizes the role of environmental factors in influencing behavior. Remember, behavior is shaped and maintained by its consequences, and this can be reworded as consequences establish or strengthen or weaken behavior. What I'll do next is I'll briefly expand on the basic principles of behaviorism, as most of you might already be familiar with them, so I'll not spend a lot of time dwelling on them. Positive reinforcement, this is when something good is added to the environment, positive, as a consequence of behavior, reinforcement, to increase the future frequency of that behavior. Now, similarly, though punishment decreases the likelihood of undesirable behaviors, ABA therapy typically emphasizes on the use of positive reinforcement to promote positive behavior change. There is something that we use instead of punishment, and I'll come to that in a bit. Positive reinforcement is usually of 5 types, abbreviated as EATS. It could be edible, it could be an activity that you can provide, it could be tangible, like things, it could be social, like social settings and activities, and it could be sensory experiences. Prompting or prompt fading, as the name suggests, is the use of prompts or cues to help individuals perform desired behaviors, with prompts gradually faded over time to promote independence and skill acquisition. Now, extinction is the gradual reduction and eventual elimination of behavior by withholding reinforcement that maintains the behavior. Well, this basically leads to a decrease in the behavior over time, and this is exactly what is used in place of punishment. So instead of giving something that is not nice to the learner, we take away the one thing that reinforces a certain behavior, which leads to extinction and diminishing behavior. An example could be Julia throws a tantrum. Now, instead of responding to the tantrum in any way, which might also include getting angry, so a response will basically reinforce the behavior. So when Julia throws a tantrum, dad withholds attention and does not reinforce the tantrum. Over time, what will happen is the tantrum mechanism to seek attention is likely to decrease. Shaping is the reinforcement of successive approximations of a target behavior until the desired behavior is achieved. Now, shaping involves reinforcing behaviors that are closer and closer to the target behavior, gradually shaping the behavior towards the desired outcome. Chaining, this involves breaking down complex behaviors into smaller, more manageable chunks and teaching each step individually. Now, once each step is mastered, they are linked together to form a complete behavior chain. And generalization, this is really important in ABA. Generalization basically focuses on the ability to apply newly acquired skills or behavior to a variety of situations. Now, this means demonstrating a learned behavior in the presence of factors that were originally not present in the environment. And those factors could be, doing the same behavior in a different place, at a different time, with different materials, and with different people. Now, it is important that a child learns to generalize the behavior that they've learned if the behavior has any chance of being maintained. So overall, these are the 6 principles of ABA therapy, which provide a systematic and evidence-based approach to understanding and promoting positive behavior change. We'll move on to the more interesting parts, the ABA assessment and the planning of treatment. Now, the process of any behavior usually consists of 3 parts, and these are called the ABCs of behavior. The first is the antecedent, which is basically the buildup of events to the behavior. Could be the location, the person, the activity that triggers the behavior. And this answers the question, what happened right before the behavior occurred? The second is the behavior itself, which is the response to the antecedent. And we note the behavior by answering the question, what does the response look like? And finally, C stands for consequence, which basically answers what happens after the behavior occurs. So basically, how did the environment, which could be in literal sense the environment itself, or the people in the environment, respond to the behavior? Now, in autism, sometimes the antecedent will be clear, but at other times it may not be clear. What can be said with absolute certainty is that the child is demonstrating a challenging behavior because it definitely serves a purpose and meets a specific need for him or her. Now, understanding why the behavior might be happening is the first step to replacing it with more appropriate behaviors. Excuse me. Now, observing and noting current behaviors helps identify the issue. Now, what you see on your screen is an ABC chart that helps in exactly this. It is used to record the antecedents, the behavior itself, and the consequences of each instance of an undesirable behavior. Let me give you an example. Say, suppose during snack time at school, 4-year-old Bobby sits down with 3 other children at the table. The teacher notices that after looking at Sally, who is sitting right beside Bobby and is holding a cookie, Bobby starts banging his head at the table and screams at a high pitch. Obviously, flustered, the teacher takes the cookie from Sally, breaks it into half, and gives a piece to Bobby. Now, you are an ABA therapist sitting down and observing this interaction. As an ABA therapist, let's try to break down the interaction of what we observed into this ABC chart. Now, obviously, we'll put down the location, which is the snack table, date and time. What was the antecedent? What led to the behavior? Bobby sat down at the snack table and looked over. He saw Sally had a cookie. What happened after that? What is the behavior that Bobby presented? Bobby bangs his head onto the table and began to scream at a high pitch. Great. What happened after the behavior occurred? How did the environment respond? The teacher took Sally's cookie, broke it in half, giving Bobby 1/2. Now, the note or alternative response section will basically have your observations and your thoughts about the interaction. And in this case, it will be Bobby might learn that screaming will give him his desired tangible item. This is to be replaced by more appropriate behavior, such as asking for the cookie without throwing the tantrum. Now, if possible, let's go into breakout rooms maybe and give it a try ourselves. What we'll do is we'll break you down into smaller groups, and each group will think of a hypothetical situation that you might be observing as an ABA therapist, and put it down into an ABC data chart. Now, try to make it as objective and descriptive as possible. And if need be, you don't really have to focus on the location, date, and time. Maybe just focus on the ABC and the note or the alternative response. So what I'll do is I'll stop sharing for now. And is it possible, Anush, to maybe get into breakout rooms?
Looks like if I can make you the co-host, can you bring out the breakout rooms? Because from my interface, I'm unable to open the breakout rooms.
Okay.
Alicia
Now
can
that-
try making you host. So
Sure. Actually, what I am concerned about is it might take a little bit of time to create the breakout rooms now, from scratch.
oh, is that so?
Yes.
I don't think I see a option to come up with the breakout rooms in my interface. That wouldn't be.
Okay. Okay. Maybe we can do it as a bigger group together, instead of going into breakout rooms, because we are 25 people, quite a manageable group, don't you think?
Yes,
Yeah, we can
definitely.
do
That sounds great.
Yeah, let's do that. Let's save some time. Great. So maybe let's come up with a situation. Anyone wants to volunteer something similar to what happened with Bobby and Sally?
I'm good with throwing tantrums, actually.
Are you?
Absolutely.
And what causes these tantrums? What do you think?
Missing out on something savory.
Okay, that is interesting. So maybe let's create a situation where Anush is now a 4-year-old and he absolutely is craving something savory. He's at the snack table at school, and he saw that his friend beside him, let's say Salim, has something savory, and he really wants it, but Anush isn't really able to verbalize and ask for it. So he starts throwing a tantrum and he starts screaming. And what does the teacher do after that?
I'm assuming Krishnan sir can be the teacher.
So would you like to be the teacher?
I'm really tired and I may be probably oscillating between different things. So better, I'll just be here. That's it.
Right. So maybe Thiam sir or Pradipta ma'am could be one of the teachers. And what would you do if you see this child throwing tantrums after looking at Salim's, savory snack?
Yeah, is Dr.
I prefer Pradipta madam to respond to it.
Why not yourself?
I will come to that. Yes, yes.
Okay.
Pradipta madam. Yeah.
Okay. According
First you
to
respond.
Abhisweta,
Shall I interrupt?
yeah, according to Abhisweta, she said that we first, one example where she had given a she was saying that
Shall I interrupt?
we should ignore the behavior.
Hello.
Yes.
Ma'am, I feel Pradipta ma'am is midway through something. So probably we'll
Yeah.
let her continue with that and then you can give your
Yeah.
thoughts.
Swarnalata or Dr. Swarnalata wants to speak, she can always do so. No. I was saying that we can ignore the behavior.
Absolutely.
Yes.
Yeah. That's a good one. We can definitely ignore the behavior. Swarnalata ma'am, would you like to say something? You're on mute, ma'am.
Swarnalata
Sorry.
ma'am.
Ma'am, in our school, these kind of an incidents, what you told, a few things have happened. The first thing as a counselor, what I do is, if the child allows. Some cases they may not allow, but in my experience, the hug actually makes them calm down. If the child allows, if the child is very hypersensitive for touch, it may not work. But the hug helped me a lot to give that energy to the thing and make them calm, that security. I feel that will make them. I have done few times in my experience.
That is a good one, of course. You can always hug a person to de-escalate them and, calm them down. That's a great one. And we have Srividya who posted in the chat. We can first assure them by saying, I know you're upset about something, and ask, may I know what it is? That's a great one, Srividya. Would you like to add to it? Or was that about it?
Yeah, if the child is willing to share, then we can just ask them what it is and we can help them to verbalize it instead of throwing tantrums. Maybe we can help them, we can model that behavior. If you want something like this, maybe next time will you ask, like, I would like to have this, something like that. If we model that behavior and if they are in the listening mode, all these things will work only when they are in the listening mode. If they
Yeah.
are in the listening, when they are in the listening mode, and if they are, when we try to model the behavior, if they are ready to accept it, maybe they will try it next time.
Yeah.
Instead of throwing tantrum, they may just ask as how we model that behavior.
Yeah. That's a good one. Thank you very much, Srividya ma'am. So all of these responses are really nice, but there are a couple of issues. Now, first,
May I
sometimes,
respond?
sorry, yes, sir.
Sorry, ma'am. Just want to give some supplement. Overall, whatever Madam and the rest of the participants, whatever they suggest, that is well taken. And one more thing which I want to bring out here in this discussion, in this forum, is that as per the literature, majority of the autistic spectrum disorder at the higher side, most of them are in the average to the average IQ, and some are in the borderline, and mental retardation is quite less, very few. So taking this opportunity, so it will be possible to modify, reframe, something like prompting, training. I prefer some positive kind of reinforcement, as one of the participant stated, some reinforcement, a positive kind of reinforcement that I appreciate, some like hugging, not necessary to give all the time chocolate, but simply hugging and appreciating, clapping. This is also one kind of thing. And obviously, as you said, Madam, ABC kind of this model, no? This is, it will work, it seems.
I also understand that
that's much.
edibles are also a method of positive reinforcement, just like tangibles and sensory responses. So edibles are something that can work, and just like Pradita ma'am said, from an objective standpoint, I feel like a hug, form of affection, is something that could work, at least for me, from an objective standpoint. I don't know if when I was 4, that would have worked on me, but that seems like a promising mode of action.
Yeah, sure. Any other thoughts, any other reactions that you would have given to the situation? Anyone? Okay, I'll take the silence as a no. So those were all really good responses, but now we need to consider one thing. The children that we're talking about are autistic, and a lot of times depending on where in the spectrum they lie, autistic children might not like physical touch, especially when they are throwing a tantrum. And secondly, it might be even more difficult to help them verbalize, place a demand on them that, okay, tell me, what do you want? Because they at that moment feel that nothing's in their power and they just simply want something that they cannot even express. So we will get into this later on, but that's great. So the antecedent was, Anush sat down at the snack table. He looked over at Salim, and he really wants that savory food. The behavior that Anush showed was he threw a tantrum, but he wasn't really verbalizing anything. And the consequences were the different kinds of consequences that we just talked about. We either, just remain neutral, which is actually, Pradeepta ma'am, a very good kind of a decision, which I'll expand on later on, or we maybe gave the child a hug, or maybe asked the child, tell me what's wrong, why are you upset, maybe I can help you. Now this might teach Anush, because he's getting attention after throwing a tantrum, that if he wants something, if he throws a tantrum, he will get attention, he will get the thing he wants, and everything will be fine. So we are basically reinforcing tantrum throwing. So going back to my slides here, screen 2. Okay, my screen should be back visible again.
Yes, ma'am.
Okay, so great. We basically know how to fill in an ABC chart. We did a small activity about how to do it. But expanding more on why Anush might be throwing a tantrum. Well, see, basically on the information that you've gathered from the ABC chart, and one more actually thing, that while you're doing this ABC chart, at this point, you might also want to interview the teacher, the class teacher, about the frequency of such behavior and the purpose behind it as observed by the teacher. And, you might hold similar interviews and questionnaires with their parents, other caregivers, about the child's behavior patterns, triggers, and environmental factors that may influence their behavior. Now, you have a lot of information, you have observed the behavior, you've put it down as notes. Now, what you're basically going to do is you're going to try and understand, why is the child behaving that way? Now, what we basically observed is Bobby or Anush, they were throwing a tantrum. We weren't sure why were they throwing a tantrum, right? At first instance, we wouldn't really understand. Now, as a therapist, what you'll do is you'll try to now formulate a hypothesis about the purpose of the child's aggressive behavior. Now, this process is called functional analysis of behavior, or functional behavioral assessment. This basically helps in developing target interventions, because this will now help you in understanding, why is the child behaving that way? And usually there are 4 reasons why a child may be presenting difficult behavior. The first one is escape. The child may engage in challenging behavior to get out of an activity, escape a demand or task, or simply avoid people. An example could be, dad tells John to eat his last carrot. John doesn't want to eat his carrot, so he spits out the carrot and throws a tantrum. So dad says, okay, go play. This is basically reinforcing the behavior of tantrum, because now John thinks, if I throw a tantrum, I don't have to eat a carrot. The second is attention. The desire to get social attention or a reaction from another individual, it could be a parent, sibling, teacher, peer, can also elicit challenging behavior from the child. The child may be looking for attention in any way possible. It could be looking at the child, hugging, praising, talking, helping, laughing, or even getting angry. When you look at the child and you're getting angry, it is a form of attention that you're giving to the child. An example could be, mom is working in her office, so Julie throws a toy at the mom. So mom stops working and comes over to Julie. Now, the child has learned that throwing a toy when mom is working will result in attention from mom. On the other side of the spectrum, a child cries whenever the parent is on the phone. The parent is frustrated and yells, "Stop crying, I'm on the phone." And the child now is learning that crying when the parent is on the phone will get them attention, even if it's shouting, because they basically don't understand the difference between the different kinds of attention for an autistic child. The third is sometimes children may engage in challenging behavior to get access to a desired tangible item or activity. Like Bobby or Anush, they wanted the savory snack, and that is why they threw the tantrum. Now, the tangible items can include food, toys, computer time, or even a turn at the game. So, an example would be John reaches for the cake. Dad says, "Not right now." So, John flops onto the floor and starts screaming. Dad gives him the cake. This is teaching John that throwing a tantrum will get him access to the desired object or activity. And finally, and this is very frequent, it is possible that the challenging behavior is internally pleasing or reinforcing in some way. The behavior seems unrelated to an external stimuli, and it does not give an indication of its function, as they occur across different environments and even when others are not around. An example would be Abhisweta. She likes moving back and forth, rocking back and forth, even when she has access to tangibles, no demands have been placed on her, and has attention from others. Now, what happens after such behavior plays a crucial role on how the behavior develops. Now, all right, you have noted the behavior, you have thought of a hypothesis that, okay, maybe Anush is throwing the tantrum because he wants a tangible item, or maybe Abhishweta is rocking back and forth because it just satisfies her internally in some way or the other. This is a hypothesis. It is really important, if you want to do evidence-based therapy, to test your hypothesis. You must conduct further observations, and you can do this by manipulating the social or the environmental context in a controlled situation. Now, testing the hypothesis is really important because, number one, it helps to confirm your understanding of why the behavior is happening. By manipulating antecedents and consequences in controlled experimental conditions, you see how environment impacts behavior, ensuring interventions target the behavior's purpose. Secondly, you will be able to identify effective intervention strategies when you try out and compare different intervention strategies. You'll be able to ensure that the intervention you choose after you test your hypothesis is evidence-based and tailored to the individual's needs. And finally, by testing out different intervention strategies, you will be able to evaluate their impact on behavior and therefore refine and adjust your approach to best meet the individual child's needs. So always, if you're hypothesizing something, always test it out. Now, you've observed the treatment, you've observed the behavior, you have a hypothesis, you've tested the hypothesis, and you're pretty sure that this is why this certain behavior is happening. What you want to do now is really implement the treatment. I will provide an overview of 5 interventions that are commonly used in applied behavior analysis, but that might be a lot of text on one screen. So don't get overwhelmed, because after this, I will share, really practical, short form, shortcut approaches to implementing your intervention. The first is really discrete trial training. DTT is a structured teaching method that breaks down skills into small, discrete components and teaches them systematically in a controlled environment, almost like chaining. You break a task down into small parts and chain them together and teach it to the child. Now, each skill is taught using a series of trials with clear antecedents, which could be instructions or cues, responses, which is obviously the desired behavior, and consequences, which is the reinforcement or the feedback. The second is naturalistic teaching, which is also known as incidental teaching or embedded instruction, which follows the child's lead in his or her own natural environment and incorporates their interests and preferences to teach and reinforce skills. So we are not really messing around with their environment. They are in their natural environment, and we are trying to observe what is it that interests the child and leverage that to teach them skills. Now, this can be done through meaningful interactions and activities to promote skill generalization and spontaneity in natural settings, and just really independence in their natural settings. Pivotal response treatment, or PRT, targets pivotal development areas like motivation, responsivity to multiple cues, self-management, social initiations. Now, it uses the natural teaching methods and the motivation techniques, such as maybe reinforcement of attempts and choices to promote the individual's motivation and initiate to, an initiative to engage in social interactions and learn new skills. Then social skills training, as the name suggests, it teaches specific social behaviors and communication skills for successful social interactions and communication. This helps the individual understand emotions. And this is exactly why hugging an autistic child all the time, I'm sure it works most of the times, but sometimes it might be a little problematic because they have difficulty in understanding emotions. They don't even understand that a hug is a sense of love and comfort and care. So really depends on the spectrum. And really problem solving and social cues and all of that can be solved through the social skills training. And finally, I'll not ramble on too much. Functional communication training, or FCT, it teaches alternative communication skills to replace challenging behaviors such as aggression, self-injury, tantrums. It's really effective for those struggling to express needs verbally or using problem behaviors to communicate, just like Bobby or Anush did, and reducing frustration and challenges. Now, I know all of this is too much. This is overwhelming to remember. So what I'll do now, I'll share some strategies that I used during school day. Now, obviously, school days mean limited time. So we want to optimize the time to teach students how to meet their needs, become independent in academic and life skills, and handle situations that they may not like, but are necessary, like safety skills or even dealing with disappointments. And I feel like I myself need to learn how to deal with disappointments on an everyday basis. So this is really interesting. Our focus during the school day is always to be proactive. We want to capture and contrive every learning opportunity throughout the day by ensuring that the students basically are being positively reinforced at every opportunity possible whenever they engage in appropriate behaviors. Now, as the behavior starts with an antecedent, which is the cause of behaviors, we will start with, default antecedent strategies. First one is pairing. Just having a strong rapport with the learners is essential to keep the learner interested in a task or activity. Really build up that relationship so that they feel comfortable and safe in your presence. Take every opportunity throughout the day to create a strong rapport with the learners, mostly through various forms of positive reinforcements. Remember EATS abbreviation, really helpful. Then preference assessments are usually used to assess current interests of a child. Now, when we are children, and even now as an adult, our interests keep changing and moving. So it's really helpful to regularly assess what are the preferences of the child. Using the most motivating items and activities will actually increase the learner interest in a task or activity so that the learner does not want to escape or avoid a situation. Then comes the first then board, and this is very much used. This shows the learner what he or she needs to do to get the preferred item or activity. Well, this helps in transitions and placing demands. Now, this is basically an example. So the pictures usually on these boards are detachable. You pick them out and you place them on the first then board. An example could be first work, the first picture, then toys. Another example could be first get ready, then outside. So these are really visual cues in a board, first this, then that, which really help in transition procedures. Similarly, there are visual aids that are used throughout the day, primarily to indicate transitions again. When a learner begins in the school, you will spend time pairing the visual with the location it represents via tangible reinforcements. I'll give you a simple example. Food can only be asked for at the snack table, not at the bathroom. So when a child is in the bathroom and says, I want apple, what you do is you show them the picture of the snack table or apple and you say, snack table. Like this is to be asked for at the snack table. And when they do it, you reinforce them with a tangible item, could be food, could be toys, anything. So you pair these visual aids with the places that they're meant to be asked at. Now, the first then board and the visual aids are a part of what is called the Picture Exchange Communication System, or PECS. This approach is basically a modified version of applied behavior analysis program designed for early non-verbal communication training. And excuse me, and as you can understand, this is all symbolic training. So this program is not designed to teach speech, although speech is encouraged indirectly, because whenever you'll be showing a picture, you will be verbalizing apple, first work, then car. So this is the reason why some children begin to spontaneously use speech while enrolled in the PECS program. As we're talking about transition in combination with PECS, giving the learner a transitional warning, such as toy time is finished in 3, 2, 1, and then taking the toy will basically help the learner to expect transitions and when something is ending. So this basically helps with the need to escape or avoid a situation caused by the frustration related to transitions. We all know people with autism might really struggle with transitions and sudden changes. So giving them a warning, it's in 3, 2, 1, over, it really helps them to be prepared mentally for the transition. Also be mindful to not just finish an activity that has a discrete end before giving the student a chance to finish it. For example, if someone's working on a puzzle and they just have to put the last piece of the puzzle in, you can wait 2 minutes. It's not going to be a problem. Give them an opportunity to finish what they're doing, and then give them a transitional warning. Okay, toy time finishes in 3, 2, 1, done. We go to the bathroom or we go to the snack table. Providing choices, and I feel like this helps neurotypical adults as well. The more choices we have, the more in control of our day we feel. So it basically helps in increase interest or motivation in an activity or task, and also ensure that the student has a say in decision making throughout the day. So this can be as simple as asking the kind of reinforcement they want before engaging in a task. So for example, me asking, would you like to work for chocolate or cars? So they have the option to choose what kind of reinforcement that they get after the work. It can also be embedded into less preferred tasks to allow students some control over a task that they may not enjoy. So for example, if I don't like group time, I might really appreciate the teacher asking me which chair I want to sit on, yellow or green chair. So really small things like that can help a student have a sense of control throughout the day. Behavioral momentum, this basically involves interspersing mastered old tasks that need to be maintained with more difficult or new tasks. Sounds confusing. I know, I'll simplify it for you. It helps build momentum by reinforcing the student for completing really easy tasks before presenting a difficult task, which would look like an old task that the student has already mastered. Every time the student does it, you provide a reinforcement. You do it for 3 times, and then without warning, you present them with a new hard target. Once they achieve that target, you reinforce it. So you see how you build up the momentum to do a task, and then present them with something new, and they're already in the momentum. So when a ball is rolling, it's easier to keep it rolling, right? One thing that I'd like to point out is if the student does not achieve the new hard target, initially we would reinforce them so that they don't, dislike the new hard target. But as we go on, we will only reinforce them when they achieve the new hard target. So easy mastered task, reinforcement, new hard task, reinforcement. Environmental enrichment. Now, this could be challenging in normal school settings, which basically means regularly changing the toys or activities in the environment. So the environment itself becomes new and engaging to the learner. This could be as simple as changing the posters, as simple as changing the toys. We usually do it weekly, but again, this could be so challenging that we can do it fortnightly in 2 weeks. But this is really important, so that in accordance to your preference assessments, you can keep toys and enjoyable items available to the student that the student likes and is engaged in. And finally, really important, reinforce, reinforce, reinforce. Instead of just reacting to inappropriate behavior, which is equally important, consistently and proactively reinforce appropriate behavior throughout the day, like when the child completes activities or is engaging appropriately in the classroom. Also remember to praise the child's independent transitions consistently. Now, obviously, we know some children, and I'm unable to keep a track of time, so please let me know if I'm running over time, and I'll fly through everything else. We know that some children may engage in challenging or inappropriate
5 minutes
behaviors.
more.
5 minutes more, right? So I'll definitely have to fly through. So when the children engage in challenging or inappropriate behavior through the school day, which might look like tantrums, aggression towards self or others, what we do is we do reactive strategies. Now, though all behavior serves a function, it might not be clear initially, as we saw from the example at the snack table. So the default is usually to keep calm and don't panic. Let following through take as long as it wants. Don't worry about noise levels. Let them scream, but let them calm down on their own. Block any attempts of aggression or self-injury, but remain completely neutral and minimize attention as you do so. You might not even want to speak, and this is exactly what ma'am said about not reacting. Be neutral, don't even speak to them, don't say no, don't do this. Be there, but just stay with the child. Block from any reinforcement. The child should not gain access to anything until the inappropriate behavior has stopped. If the child grabs something, gently take it away from the child. Do not let them have it, but stay with the child. Keep the voice, body language, and facial expressions neutral, because even if you get angry or concerned or anything, they will take it as attention. Now, if the challenging behavior occurs after the demand has been placed, use a visual cue that corresponds to the demand that has been placed. Example is snack table time, and show them the snack table picture, or first work, then car, and then restate the verbal demand with visual cue every 30 seconds approximately. There are a couple of things to keep in mind. You can obviously gently prompt the child to follow through when you are reinstating the demand, like holding your hand out or gently nudging the elbow to encourage them to stand. But do not lift, carry, push. Do not do anything that the child is not doing by themselves. If the child is not responsive, discontinue the prompt and resume the neutral stance. Retry again after 30 seconds. Keep repeating this until the demand has been fully followed through. And once finished, resume the proactive antecedent strategies, reinforcements, and the normal timetable. And if no demand was in place and the behavior emerged by itself or due to a desired toy or location not being available, redirect them to another activity or model and model appropriate behaviors. So for example, redirect them to another box of toys and demonstrate playing with those toys in front of them, while at the same time ignoring the behavior if it is safe to do so. Be careful not to place any additional demands until the situation is de-escalated and the child is engaging in an alternative activity. Important, phrase language positively. Tell the child what they can do instead of what they cannot do. Avoid saying no or not available or you can't play with this toy. It is important that the child is not redirected to the literal same item that they were seeking when they began to engage in inappropriate behavior. They can only have access to this once they have been redirected and engaging appropriately in another activity for at least 30 seconds. Again, reinforce alternative appropriate calm behavior with specific praise and attention. Be really specific with your praise. For example, nice playing with the yellow car. If the child was throwing a tantrum because they wanted to play with the green car, be as specific as you can. Finally, if it has gone through, resume proactive antecedent strategies and the timetable as usual. Monitoring outcomes, I'll literally fly through these, but again, really important. We do ongoing data collection and data-driven decision making to really methodically and impartially monitor the individual's behavior. It empowers basically therapists to notice patterns and trends in behavior, which in turn helps in monitoring the overall progress. By scrutinizing progress, what you can actually do is ascertain the effectiveness of current interventions in meeting individuals' needs, and determine if adjustments are required, which will lead to outcome evaluation. And this will mean checking to see if the therapy is working well and making the person's life better. If need be, the therapist might adjust goals and change interventions, which restarts the process of data collection, progress monitoring, and outcome evaluation. So it's pretty much a cyclical process and really important. Last section, I'll fly through ethics, misconceptions, criticisms, and alternatives. These are a few ethical considerations and best practices, which are pretty much the same in any therapy that you will be undertaking. Respect people's autonomy, act in the best interest of individuals with non-maleficence and beneficence. Make sure that you are fair and equal when children come to you. Definitely respect and address cultural diversity within the community. Safeguard sensitive information and share only as necessary by law or standards. Obviously, competence is important. Possess the necessary knowledge and skills for effective care. Goes without saying, avoid harmful or non-evidence-based practices or practices that lack empirical support. And finally, collaborate, communicate openly with the people who, with the individuals and their families and caregivers. And a few misconceptions, pretty much I've gone through it during the course of the presentation, but I'll let you to it. I'll not go through it word by word. But it is ABA is pretty much a very strong mechanism for dealing with children in the autistic spectrum disorder. There have been some criticisms. ABA does not cure all children of autism, but ABA was never meant to cure autism. It is a support for people living with the ASD. ABA has not been compared to other treatments. So if you're thinking about, what should I research on next? Maybe try comparing ABA with other treatment plans. And ABA has not yet identified who benefits most from ABA interventions. What is the age range, or what is the socioeconomic or ethnic background, which is most effective, which is the best affected by ABA. There are other observations, but one thing that I would like to highlight is usually in normal settings, ABA therapy focuses too narrowly on teaching specific skills in controlled environments like schools. And we really don't yet have the infrastructure to do naturalistic kind of ABA. So it's usually schools that work in supporting individuals with ASD. So this leads to limited generalization and maintenance skills in real world settings. And this can obviously be helped through communication and collaboration with the parents, the caregivers, and all of that. And alternative approaches, I'm not going to go into details, but there are developmental approaches, relationship-based interventions, sensory interventions, strength-based interventions, and peer-mediated interventions. I'd planned to go through these in a bit of detail, but we're lacking time, and I'll let you do some homework and take a look at alternative approaches of ABA therapy. Quick recap, we went through what is ASD, what is applied behavior analysis. We did some behavioral principles on which ABA stands. We did ABA assessment and treatment planning. We went through treatment implementations, the 5 techniques, and the proactive and reactive strategies. Why monitoring the treatment process and outcomes are important.
1 minute left.
Ethical, right, I'm almost done, sir, almost done. Ethical considerations and best practices, misconceptions, criticisms, and alternative approaches, which we did not go in detail, but there is a big overlap between all different kinds of approaches used for ASD. So what is really suggested is you used eclecticism and really take in the best parts of different approaches and tailor it, really just tailor it according to the child that you're dealing with. And that will be it. That's my contact detail on your screen. I have provided a link to My Brain, which basically helps in bringing people together, both caregivers and people going through a certain disorder or an ailment. And it would be lovely to connect to any of you for any collaboration. And thank you very much. I'll take any questions, if any.
So before that, may I ask the audience to give her a big applause? So everything was well described and very great and very specific. And at the end, Madam also says the eclectic approach. So that is well taken. And one more thing which I want to add on is that psychology is the only subject which deals with the behavior, and it is a very challenging to deal with this kind of special child. So as we being a psychologist and as we being the expert of dealing with the behavior, I request and I urge to all the psychologists not to give up so easily. Dealing with this kind of children, it takes time, but definitely improve in their behavior. And as I said so, according to the literature, at the higher side, majority of them are in the average kind of intelligence. So with that, I just want to take off some 1 or 2 questions briefly, if there is any doubt.
Can I just comment myself?
Yes.
Okay. So thank you, Abhisweta, first of all, and let me just inform all of us that I found Abhisweta as most professional and extremely committed in the whatever job she takes up, because I used to have a lot of experience with various speakers and friends over getting down to this platform. I found her as how genuine, how much heart she puts into the program, whatever she does, and she definitely deserves a big hand. And I would always hope and feel sincerely, Abhisweta, that MAP will definitely try to organize a long-term program. Not just this kind of this just an orientation. We'll have a discussion with you in course of time, and we'll definitely plan to have a genuine program, because here in India I've found that most of the half-baked psychologists are many times spoiling the whole scenario, creating a lot of confusion, especially being a pain to the parents of the children with the autism spectrum disorder. So something more tangible, something more feasible, something more scientific, evidence-based. It's a need to be given for these people. So we'll plan that. That's from our side. Definitely we'll do it. I will connect with you later. Thank you. Thanks a lot for all the support from my side. Thank you.
Really appreciate
Thank you so
it.
much. Any questions? Any questions? Nothing. So I hand over to Sir Krishna Gireesh, sir, for the or is there anyone for the vote of thanks?
Vote of thanks. Yeah, usually it goes by Anush Chakra Satyamurthy. It is his prerogative. He always does it.
Yes, sir. I'll go with the vote of thanks. So I'll right away get into it. So I'd like to begin by thanking our founder, Dr. Krishnan sir, for organizing this meeting and bringing forth the most resourceful Madam Abhisweta Bhattacharjee, because she knows her stuff. We all have realized that she's really informed about what she's talking about. So I first of all want to thank our dear Gireesh sir for organizing the event. Then I'll go ahead with thanking our dear professor, our Tiyam Kiran Singh sir, for introducing and acknowledging all of us in the beginning. Thank you, sir. Then I'd like to thank our dear academic coordinator, Pradipta ma'am, for giving her insights on today's webinar. Thank you, Pradipta ma'am. More than everything, I'd like to thank our dear Abhisweta ma'am. Just like Krishnan sir had said, many times, if we have somebody who's that resourceful to tackle a crisis, like we have so many people with autism in our country. I understand one of the people in our community, one of the executive members actually. I remember once talking to this person. Her daughter actually has autism. So she was telling me about how our dear Veena Krishnan Singh, she's one of our executive members. She helped her through the process of tackling this crisis with her daughter. I refrain from mentioning the name who this particular person is, but still, yeah. So they had an experience to tell me. So I feel like when we have somebody who's resourceful to give us the tools to tackle a certain crisis, we'll perform the best. So you made sure you elaborated it in such a way that we all know that you are really sorted with your stuff, with your resources, with your subject. So thank you, ma'am. Thank you for a wonderful, resourceful, insightful webinar. Then I'll go ahead with all the thanking every executive member present here. With that, I'll wind up my duty.
Thank you so much. It was an absolute pleasure to be here and have such a wonderful audience. I'm glad I could contribute positively to your experience today and hope to see you again.
Sure, sure. Very nice of you.
Thank
Have
you
a
very
nice
much.
evening to all of you.
Thank you.
Definitely.
All of you too.
Thank you, ma'am.
Thanks.
Meeting
Bye.
will now come to comments.
Yeah,
Okay. Good night.
great. Thank you. Bye.